So this short screencast is going to give you a very brief overview and a bit of a reminder really of why we need to change behaviour, what behaviour change is and how we're going to go about it. And this is the first of a few screencasts that are just going to introduce this subject for you. So it might be a bit of revision. So this short screencast is going to give you a very brief overview of behaviour change, why we need to change behaviour, what behaviour change is. And as we go through this session, we're going to kind of think a little bit more about how we go about behaviour change. And so this initial bit may be a bit of revision, but you might want to refer back to some of the information later. So just this kind of reminder, it takes you back to dietetic practice and long-term conditions really, thinking through what it is about our health behaviours that influences our health conditions or medical conditions. And so there's a lot of this you may have seen, remembering that chronic diseases such as obesity, diabetes, cardiovascular disease, cancer are often related to behaviour. And if we can undertake interventions that help people to change their unhealthy behaviours to healthier ones, we've got the potential to improve health and decrease healthcare costs. And this particularly relates to overweight and obesity, but not just that, it's other lifestyle factors such as smoking, excessive use of alcohol and recreational drugs as well. So there's a lot of information here that tells you if we can change behaviour, we can lead to an improvement in health. So think through those things and what impact they might have. And this health profile for England just reminds us of those conditions that are related to health behaviours and how those have changed over recent decades. So we've got still a high prevalence of high blood pressure, hypertension. We've got many who have increased or high risk alcohol consumption. We've got a high prevalence of obesity. The prevalence of smoking, thankfully, is still continuing to go down, but there are pockets of people, particularly in the lower socioeconomic classes, that or areas of deprivation, where people are much more likely to smoke. We still have quite significant number of people who take recreational drugs, and we've still got quite a lot of people who are not undertaking the minimum recommended level of physical activity of 150 minutes per week. So although we've got 66.4% say they do, that still leaves us with 35.6% who don't. The 5-a-day message, fruit and vegetables, still isn't really getting through and being translated into behaviour. So if you add all of the COVID and the cost of living crisis and all of the impact of those things, you can see that the health profile is not good, and therefore a lot of these things are leading to healthcare problems. So we need to try and support people to change. And the statistics, these are still the most up-to-date ones available, relating to hospital admissions and obesity. So the number of people living with overweight and obesity is still very high, and it's having an impact both in hospital admissions and in health and use of medication, those kinds of things as well. So there's a lot of things that are impacting on our healthcare costs, which we could do something about. So what do we mean by health-related behaviour change? And one of the things I want you to think about is that it is not just about our working with one-to-one in a kind of clinic or in a ward type situation. We are looking at community and public health aspects as well. So what we're hoping is that we can work with people to help them to turn away from, abandon health compromising behaviours such as smoking, poor diet, being inactive or lots of sedentary behaviour, drinking too much alcohol, using recreational drugs, or stress. And it's really important that that's not forgotten, because stress management is, on the other side, is that way of helping to maintain health enhancing behaviours. So we want people to only consume alcohol at a safer level, to have a healthier diet, to manage their weight in the healthy range, to be more active, and to manage stress and to rest. So we've got that kind of things we want people to stop doing, things we want them to start doing or do more. And the whole idea of what we're trying to think about with behaviour change, and we are supporting behaviour change, that's what we are hoping to do as dietitians. If we look at that individual aspect for a moment, what does that actually mean? And it means that we are doing something that is aiming to help an individual with a specific health condition or at risk of one, or a behaviour that might affect their health. So that might be that person who wants to have a healthier diet, who's living with overweight, who's pre-diabetic, for example. So not just one-to-one consultations. This can be done in groups. So this might be group education, but it can also be done at this population level. But the key thing that we need to be mindful of when we're working with individuals, which we're going to focus a lot on in this module, is about creating measurable change in that person. So we are supporting that person to, for example, decrease their energy intake sufficiently to enable them to lose weight. Perhaps decreasing their salt intake sufficiently to help bring their blood pressure down. Decreasing their carbohydrate intake to decrease the risk of pre-diabetes becoming type 2 diabetes. There's lots of changes that people can make with dietary change and other lifestyle changes that are going to make a huge difference within their health risk and health conditions. So the nice guidance that you need to be mindful of, aware of, in relation to behaviour change, there's two core documents really. But the first one is the individual approaches, and that is trying to help us to understand how we might plan and deliver and evaluate services or activities or interventions that are aimed at changing health-related behaviour. So we're not just going on good ideas or what sounds like it might work. We are looking for things that will make a difference to change, but have an evidence base. So we plan based on theory. We deliver and evaluate based on clear aims and objectives. And the whole point of doing this is so that we can actually be certain whether something is working or not, and therefore withdraw services that don't work. So we disinvest in one so that we've got more resource to invest in something that does work. So it's really important that we evaluate what we do thoroughly. And the other two guidance documents, nice guidance documents that are of particular relevance, is the general approaches to behaviour change one, which is more public health based, and then more recently we've got one in relation to digital and mobile health interventions. So that's kind of exploring that way of working with individuals to support behaviour change. So that just gives us a bit of an overview, a very brief overview of why behaviour change, what behaviour change is, and some of the core guidance that helps to guide us in how we go about it.